Well, I'd like to welcome everyone here today. Um, if you are muted, that is fine. We appreciate it if you can stay muted. You can feel free to type any of your questions in the chat, or at the end, I'm sure we'll have time for a few questions. So today I'd like to introduce Mr. Robert Fenn. He is the public affairs specialist with our very own local Social Security Administration here in Canton. And today he's going to talk about Social Security and can I work and collect a Social Security payment. So, welcome, Robert. We very much appreciate your time today.
Thank you for having me. So, good afternoon, everyone. I, I am going to talk about Social Security in the aspect of working, and then I'm going to cover a couple other topics for as changes in 2023. Uh, since the last presentation here with Altman Hospital, which I'm so gracious to have the opportunity. So, thank you, Altman Hospital, for allowing me to be able to speak on this platform. And so there's certain things that I would receive questions from the prior ones. So I said, I'm going to incorporate that near the end of the presentation. And so the way it works out is I know that we're, in this case here, putting on when you're viewing this, we're upon the holiday season and people get together, right? And then sometimes the question after we talk about how good the dinner was and those things or how not good it was, right? We may say, all right, can I work and get Social Security? And then old Uncle Joe may walk in the room and he said, you know what, they did this and they did that. You know, and you're like, what is Uncle Joe talking about? Did he have a couple extra? Right. So I'm going to cover those things about working as well as getting a Social Security payment. Just a couple scenarios. Now, I can't cover everything since we don't have that much in terms of time, but I at least needed to whet your appetite, staying with that holiday theme there. And so that way you can understand the differences and what we use in terms determine working as well as receiving Social Security benefit. Now, in terms of Social Security and myself as a public affairs specialist, I received several questions, and sometimes they're outside of Social Security's purview. And I like to make sure that I let people know I work for Social Security, but there are sources out there that if I'm able to, I can share with you to at least help you with your finances and certain questions that are not, again, in my purview. And one of those sources that I'm going to share with you is this one here. It's called a website. The website's called mymoney.gov, mymoney.gov. What is it? Mymoney.gov is a collaboration of 20 different federal agencies placing their information on one website. You can go to this website, mymoney.gov, and you can learn or at least review certain things regards to your finances. You see the plant on the tree here, or excuse me, the plant or a little small tree, whatever you want to look at it. It's called, you see the leaves, spend, earn, save and invest, protect and borrow. These same things are underneath there in My Money 5. And what you can do is you can click on this and it will give you information about spending, and best practices, earning. So let's say you wanted to create a budget for your family. There are budget worksheets on this website. You have the opportunity to learn information from IRS, VA, Railroad Board, Social Security, all on one website. It's something that even if a mother has a newborn child and they're okay, what do I need to do? There's information there. A grandparent who's thinking about, I want to buy a CD, for that child. That information is on this website. So check it out, mymoney.gov, G-O-V. It's free. It's nothing attached to it. So it's a good source for you to start. It's kind of like a financial advisor without having to pay. I said I'm going to talk about those 2023 updates. So I'm going to run through those quickly for you here. You may have heard the news. If you have not, there will be a cost of living increase in 2023 for those receiving Social Security disability, Social Security retirement, and SSI, supplemental security income. Those benefits will increase 8.7% in 2023. The SSI payment, which would have fell on the 1st of January, since that is a weekend, those individuals would receive their payment in December 30th to be exact. That will be for their January payment. Those who are receiving retirement and Social Security disability, those payments will increase in their January payment, and they will see it reflected there. There will be a notice sent to you, so that way you can see the actual amount that you're going to receive each month. Now, I need to make sure I say this because what people commonly do is they take that 8.7% and they pull out their calculator and they add that amount to their net amount that they get into their bank account, right? So they look at their bank statement, say, okay, 8.7% plus this will be my Social Security check. You're probably going to come up really close to that number. But what's my point? Why am I saying closely? If you're someone who took your Social Security payments prior to reaching your full retirement age, meaning your full retirement age could have been age 65, age 66, 66 and 6 months, whatever it may be. And you said, I'm not going to wait to 66 and 6 months. I'm going to file at 62. So we paid you a reduced amount at age 62. So what you're doing is adding 8.7% to that reduced amount. What we do is we look at your full benefit amount at your full retirement age. We add 8.7% to that. Then we do the deduction by you filing early. And my point is that you may come up with a different amount than what we did because you added it or multiplied it to the incorrect percentage, the incorrect starting point. So you could be off $1, $5, whatever it may be, because you're starting at the wrong point. So the 8.7% is added to what we call your primary insurance amount. But the statement will show that, and it will let you know what the correct amount will be. Maximum taxable earnings. Social Security taxes are taking out of a individual's wages all the way up this year in 2023. For 2023, $160,200. This year is $147,000. So next year, $160,200, they will still take the 6.2% towards the Social Security and 1.45 towards Medicare. I'm saying this because I've had individuals contact me and they will say, I am receiving a Social Security check, but I'm also working. And since I'm working and getting Social Security, does that mean they're not going to take any taxes from me? No, that will continue. Social Security is a pay-as-you-go system. So those who are working pays for those who are retired. Therefore, you still would have your Social Security taxes taken from your wages, W-2 or self-employed SE wages. They'll still do that. What this means to you is that the system will automatically pick that up. And if you're still working after getting a Social Security payment, we receive that information from IRS. IRS will take that information, notify us, and if that new dollar amount, those new wages that you're making are more than what we use to figure out how much we're going to pay you on that monthly basis, it will increase your Social Security check. That's how it would benefit you. Now, the opposite, if you are making less money than the years that we use to figure out how much we're going to pay you, then it does not go into the calculation because it would lower your Social Security check. So again, we continue to take that 6.2% from the W-2 wages up to $160,200. Social Security, in order to be insured for Social Security retirement benefits, you have to have 40 quarters of coverage, or what we call credits. And that dollar amount to get a credit will increase in 2023 up to $1,640. This year in 2022, it's $1,510. Next year will be $1,640. So as I said, you have to have 40 credits to be insured to get a Social Security retirement check. And let's say that you had 39 in this 2022, and you want to know, how do I get that one? Well, by working and making at least $1,640 next year, you'll have your credit. The average Social Security check for next year is going to be $1,827. And the Social Security disability check, there's a little typo there. It will be $1,483 next year. That would be a nice disability check, wouldn't it? So $1,483 for Social Security disability. The maximum worker, if someone were to pay that 6.2% to that $160,000 that I mentioned, last year it was $147,000. In those years prior to that, it was less. But what if someone paid the maximum taxable earnings that you see at the top of the screen And they did that for 35 years and filed for next year for retirement benefits. That Social Security check will be around $3,627. Now, I just mentioned about the full retirement age and said about that reduction. And so people want to know, okay, well, can I work and still get a Social Security check? Well, your full retirement age is based upon the year that you're born. So if you're born between the years of 1943 to 1954, your full retirement age is 66. If you were born 1955 or later, the full retirement age increases in increments of 2 months. So 1955, 66 and 2 months, all the way to 1960 or later, full retirement age would be 67. This is your starting point to determine where do you fall on which category to determine how much can you work. So make sure you recognize your full retirement age, which you can get on our website, or you can take a quick little snapshot of this page here. And these are the dollar amounts that you're going to see that you can work while receiving Social Security benefits. And I'm talking retirement benefits first. So if you are underneath your full retirement age in 2022, you could make $19,560. In 2023, you can make $21,240. So that's around $1,770. So let's just round up, say almost $1,800 gross you can make per month before Social Security is even concerned in terms of seeing if we need to hold back any payments. So next year, 2023, you can make $21,240 for the year before Social Security says, do we need to withhold sending you any of those monthly payments? Next year, if you are turning your full retirement age, as I showed you in the prior screen, that dollar amount is going up from $51,960 in 2022 up to $56,520 in 2023. Be mindful that $56,520, you can earn that amount from the beginning of the year to the month before you actually reach your full retirement age. So if your full retirement age is 66 and let's say 8 months, and let's say that 8th month is August, you can make from January to July, the month before, $56,520 before Social Security is even concerned. Has no effect at all in terms of us sending out those payments. Then August on, as it says at the bottom of the screen here, no limit. Once you hit your full retirement age, so if you're 66 and that's your full retirement age, Social Security is not concerned at all. You can make $1 million a month, has no effect at all. Now, it may affect IRS purposes, takes you different categories, but for Social Security, has no effect at all. Now, I just spoke about what if you are receiving a retirement payment and you wanted to know the effect of those wages. There are also individuals who are receiving Social Security disability or SSI, and they would like to know how does that affect them. So next year, we're going to have around 65 million individuals getting a retirement or some form of retirement, children, spousal benefit, maybe receiving that next year. 7 million or so receiving Social Security disability or SSI payments. So I'm going to cover that here. On the left-hand side, you will see the Social Security disability, which is tied with Medicare. On the right-hand side, the red pill there would be supplemental security income, SSI, which is tied with Medicaid. That's through Job and Family Services. So I'm going to focus just a little bit on the Social Security disability. What if you're getting Social Security disability in your work? And then a little bit, what if there's a combination there? If someone's getting Social Security disability, not the retirement, Social Security disability, Social Security gives what we call a trial work period. We call these work incentives, and there are several of them. But again, for the sake of time, we're not going to go over all of them. But I'm going to start with that basic component. So if someone's receiving Social Security disability in 2022, we ask that they report their wages. And what we look for is if in 2022, if they're making $970 gross or less, or next year, they're allowed to make $1,050 gross. What does this mean? Well, as it says on the screen here, there's a time to test their ability to work for 9 months, not necessarily consecutive. A person could be making next year, report to Social Security, and they're making, let's say, $1,000. $1,000 less than the $1,050 that there would count as a trial work period. So it would have no effect. So let me give the opposite. Let's say someone is making $2,000. They're making that for Social Security disability. So they found a job. They're making $2,000 in the month of January. That's 1 month out of the 9 that would be deducted to say, okay, this person is trying to get back into the workplace. So 1 out of the 9 will be counted. So now they have 8 more months. And let's say February, they make another $2,000. That's 2 out of the 9. Then let's say in March, the same thing happens, $2,000. So that's 3 months out of the 9. But in April, they make $800. $800 is less than the 1,050. It doesn't count. So even though we have 4 months who have elapsed in the year, only 3 of them are going to count against that 9. So eventually, once we get to the 9 months, then we're going to say the individual has used their trial work period. And then that walks us into something we call SGA, substantial gainful activity. That's where we look to see if those Social Security checks should continue or not. Now, let me just give an example, because what happens is people say, okay, SGA, that's different. That's right. After they've made the $1,050 gross, normally what we do is we look to say, okay, let's make it a simple example. January through September, 9 months, they made $2,000 a month. That's Social Security disability. Then we will look to say, here's October. We're going to give them what that grace check in October and November, but then it will stop in December because they're still making over that amount. But if we see after the 9th month that they are working and that they're underneath that SGA $1,470 next year, they could receive the check. What people may not be aware of, which I'm sharing with you on the screen here, we have something called impairment-related work expenses. This means that we will look at their job and look to see if there's certain things that we could expense for that will get them underneath that SGA amount. Example here, let's say someone made $1,500 per month and they have a monthly copay of medications, $75. Well, 1,500 minus 75 is 1,425, if I'm doing my math right here. And the individual now making $1,425, they're underneath the SGA, which means they can still receive their Social Security payment. This is called an impairment-related work expense. There are other work subsidies, but this is one that I'm pointing out. And these are several examples I can give you. If someone is having the need based upon their disability to have someone transport them, not just a friend or family who just wants to take them to work, but it's a structural or operational modifications to their vehicle, they could have that count as an IRWI. Or let's say someone has a service animal and there's expenses with that, having a guide dog or their prescriptions. We could then find out the cost of those items that I just mentioned and they deduct them from the gross wages to see if that makes them underneath that SGA, the dollar amount that I share with you, and I'll pull it back up here, the $1,470. That will be in 2023. So this is a good little example and something that I can share with you so that way you can at least be aware of that in 2023. Now, the last part that I'm going to share with you in terms of earnings, there is SSI. That was that little red side of the screen that I shared with you. I'm not breaking that one down as much as I'm going to break this one down. SSI, if someone's receiving supplemental security income, it is a needs-based program based upon the individual's income and their resources. The shortest way I can just make sure I answer that is any wages that the person is making, let's say if they're getting just SSI, not Social Security disability, but SSI, any wages that they make will count against their SSI payment. So we count only half of their wages. So simple example, let's say that they were making $100 from their job, half of that's 50. $50 would be deducted from the SSI check. The SSI check next year is going to go up to $910. So they're going to get that dollar amount, 910 minus the 50, so 860 is what their SSI check will be. Well, what if someone's getting both an SSI check as well as a Social Security disability? So I'm going to use these numbers here, and then I'm just using this screen here so you can see for 2019. That's all. So forgive me on that. But let's say someone's getting a check from Social Security disability and SSI. So what we do is we give them a general income exclusion. $361 is a Social Security disability check. We're not going to count all of it. We're going to take away $20 of it. So that's $341. Now let's say that they're working and they receive $289. We're not going to count all of that. We're going to deduct $65 of that. So now we have $224. We're only going to count half of that. Half of 212 is $112. So now their countable earned income is $112. They still receive $341 as their countable unearned income. And so now their total countable income, when we add those up, is $453. So in 2019, you can just substitute the number $910 in here. But 2019, that amount was $771. Subtract their total countable income. Their SSI check still is $318. Now, what we do is if we look at their wages. So here's their Social Security check, the $361. They're still working, $289. The SSI check, $318. Still take home pay, $968. Why am I sharing this? Because many times people say, you can't work and get a check, or it's not going to be an advantage to me. The take home pay is a lot higher now since they have those wages, and we do not count all those wages. Again, this example is for someone who's getting Social Security disability and SSI. This is how we work that out. If they're getting just SSI, we look at their wages, count half of it. That total then is what's subtracted from their SSI payment. Two little things I want to cover for people who are thinking, okay, I heard that there's a change. There are people often say there's changes in Social Security all the time. Like we're in the weather for Ohio every 15 minutes, or is that the Thistledown? I don't know, one of the two. Well, here is something that did change, but it took place in 2016, but people are still learning about it. And that is that if you file for Social Security benefits as a spouse, and you would like to know, can I receive money on someone else's record as a spouse who paid into Social Security? Social Security now has what we call deemed filing. That means that whatever you file, we have to look to see how much money you're due on your own and pay you that amount first. The old law said if you were at least your full retirement age, we would ignore any monies you had on your own and pay you regardless. New law says we pay you on your record first, then look to see if we can make up the difference. How do you know if you're underneath the old law or the new law? Here it is, January 2nd, 1954. If you were born January 2nd, 1954 or later, you're underneath the new law. If your birthday is January 1st, 1954 or before that, you're underneath the old law. People were asking me the question, well, voluntary suspension, what is that? Can I stop my Social Security check? Well, voluntary suspension is for an individual who says, I'm going to make over that $56,000 amount that he mentioned, or that $21,000. Can I suspend, or my analogy is pressing pause on your DVR, saying, wait a second, I gotta go get some coffee, right? Pressing pause, but the show is still there. Your money, everything is still there. It's just that you said, hold on, I don't want to do anything. Well, if you do so, if you press pause, suspend those payments, now the new law says if you're getting a check and your spouses are giving a check because of you, your earnings, that person's on your record, it also suspends their payments as well. Now, if someone's an ex-spouse, as you see on the screen here, it doesn't affect them. I don't want any ex-spouses chasing someone else around building a village because of this. So, all right. Something else is changing. I want to cover for you. Medicare. There's traditional ways of filing for traditional Medicare, and that's what we call an initial enrollment period, special enrollment period, and the general enrollment period. Initial enrollment period means a person can file 3 months before, the month of, and 3 months after they reach age 65. Special enrollment period means I'm still going to keep working past 65 because there's no law that says I have to apply for Medicare when I turn 65 if I'm still working and covered by an employer group health plan, or I'm on my spouse's insurance and covered by their group health plan. All right. Well, that's an initial enrollment period, special enrollment period, a general enrollment period. The general enrollment period is for individuals who miss those two other periods, initial and special, and they want to enroll in the general enrollment period, which is January, February, and March. In 2022, even though they picked January, February, and March in the general enrollment period, it became effective in July of 2022. That is the prior law. So there's different parts of Medicare. You have the A, B, C, and D. Original Medicare on your left-hand side. A covers when you stay in the hospital. B is for the doctors. Part D is what you can add by contacting Medicare. You can get your Medicare Part D, or you can add a supplemental insurance plan, or they call them Medigap. On the right-hand side are Medicare Advantage plans, HMOs or PPO plans. You can get that by contacting them directly to get your Medicare Advantage plans. Now, there are differences here. And that's the A and B. What's my point is, as those changes in 2023, if you contact Social Security to get your Medicare A and B, that's Social Security. If you contact Social Security to start that Medicare 1 to 3 months before you reach age 65, it'll start the month you turn 65. If you reach us the month you reach age 65 or 1 to 3 months after you reach age 65, it starts the first day of the month after that. The current law would say that if you talk to Social Security 1 month later and you enrolled, it started 2 months later. New law, it'll start the next month. That's for your Medicare Part B coverage. Same thing for the general enrollment period. If you miss the initial, you miss the special, and you have to enroll in the general, you enroll in January, it'll start in February. Roll in February, it'll start in March. Roll in March, it'll start in April versus waiting till July. So that's a good thing. And then the change takes place in 2023. Now, the standard premium of Medicare Part B, because people commonly say, well, I know if I get a cost of living increase, I know they're going to raise my Medicare. Didn't happen this year. In 2023, the Medicare Part B premium will be $164.90 versus this year's $171.10. So if someone enrolls to Medicare Part B in 2023, the standard premium is $164.90, unless you have what we call the IRMA. The modified adjusted gross income will be used. And if you're making over $97,000 or more, it's going to change your standard premium by $65.90 you see here on the screen here. So you will pay $164 as the standard plus an additional $65.90. Medicare, is getting this information through IRS and they send it to us. So IRS will see what was your 2-year prior tax return, and then that determines that. Be mindful that if you're someone who is retiring that same year, just to give you the example, there are 7 to 8 different what we call life-changing events. And if someone was to work, then retire the same year, and then IRS will send us a notification saying this person made over $97,000. They will look to add that $65.90. But if you just retired, you can contact Social Security. We would allow you to apply. There's a form called an SSA 44. You submit it, and then we could see if you meet the requirement for the life-changing event, and you won't have to pay for that. Now, if there's certain guidelines that we have to go by, and you have to get proof of you working and retiring, or if you were married or divorced or loss of property as one of those life-changing events. So just be mindful. You can contact Social Security if you think that that may not apply. Otherwise, it does come from IRS. It's not something that Social Security office automatically does. We just receive information and then it's applied to you. Again, that is the IRMA is what we call it. Medicare Part B adjustment. It only affects 5% of U.S. citizens, but I have to tell people so. You can find this information on their website directly. You can go to medicare.gov, G-O-V, and you can look underneath what Medicare covers. Then their landing page does change, but as long as you go to medicare.gov, you will see these same options, Medicare cost and Medicare coverage. So you look underneath cost and you'll get that information that I shared with you. This is our website. I'm encouraging you to check us out. Be aware of the information I just shared with you. You can go to our website, socialsecurity.gov. Normally, if you type in Social Security in your search engine, we're at the top of those links, but make sure you get the right one, socialsecurity.gov. Make sure it's not an ad or .com or .org. It's socialsecurity.gov if you want our website. And you can go to our website, socialsecurity.gov. And if you wanted to know, well, that cost of living increase, he was mentioning it, how can I be made aware of that? Well, if you have a My Social Security account, you can do so there. Some people were asking me, well, how do I apply for Medicare? If I need to apply for Medicare benefits, well, you can click on the link there. You saw this suite of people. Uh, and you can just see here how to apply online for just Medicare. Some people don't want to take the cash, so they apply for just Medicare only. You can do so by clicking that link, and you will see this right in the middle of the screen here, apply for Medicare only. Takes an average around 10 to 15 minutes. It's a simple application asking some basic questions, and it will start your Medicare benefits. We will contact you. So it's not as if you hit the enter button and everything's out in outer space, right? We still contact you just to verify that's the action you wish to take. Now, what if someone says, I didn't take that Medicare Part B, I was still working? You can take the Medicare Part A and not take the Part B and then contact us. As I mentioned, that special enrollment period, you have 8 months to contact us after the last day you have worked. And you want to come back to contact us to enroll? Here it is, already enrolled in Medicare. You click on this link, it'll pull up these forms. You will complete these forms. You can print them out. They come, they're links directly to the Medicare.gov website or through us. You can print those forms out. You can bring them in. We suggest that you fax them in. Well, how do you fax them in then? Once your employer verifies, you'll see the form. It's pretty simple. It's two forms. You have to have the CMS 40B. That's your name, social security number, and address. You sign it saying, I want to enroll to Medicare. And then you have the CMS L564. That form, it goes to your employer, and the employer fills it out saying, yes, I know Sally Sue. Sally Sue was working here and covered by the group health plan. Fills it out. The HR benefit rep person signs it, and then that form then can be sent via fax to us. As I said, how do you know where? Well, that same website, that same source, that same page. You're on the Medicare site. See on the right-hand side here, office locator. You can click on that link and it'll pull up this screen and it'll allow you to type in your zip code wherever you live, and it'll give you the nearest Social Security office. It'll give you their address, it'll give you the phone number and the fax number. And you can simply fax that information right to the Social Security office. It'll go to us electronically. We have a system now that separates everything based upon the date that you send it to us, and it associates it to a certain person. And so we'll know who received it, received that fax, and then we can process it for you. If you need assistance paying for your Medicare Part D, you can contact Social Security for extra help. Again, that's if once you've enrolled to those plans. Well, technically, you can enroll with the extra help first, but once we receive the information from whatever plan it is, then we can see if you meet those eligibility requirements. And that's based upon your individual's income to determine if they meet the requirements for the extra help. This is the holiday season, and I just want everyone to be aware that even though you're feeling, good and, family gatherings and, we're sitting down, have a good time, there are others out there waiting for you to lower, your guard to say, okay, now it's a good time for them to try to contact you, saying that they are from the Social Security Administration and that they would like to help you out. Or they may scare you, try to threaten you. That is not from Social Security. If anyone tells you via the phone that they're from the Social Security Administration and that they're threatening you that you have to take your money and put it on gift cards, Bitcoin, or some other form where they're trying to hold that money, hang up. You get one of those phone calls. There's no need for you to disclose any information at all. So again, Social Security will never threaten you. We do mail letters out saying we would like to talk to you if there was an issue. That would make sense. Now, if you also called us first and you made an appointment, that would make sense because you initiated it. That's why we return your call. I don't want anyone receiving a phone call from Social Security saying, okay, we're here to talk to you. And then you go, goodbye. Like, no, hold on. You gave us a phone call. That's why we followed up. But again, Social Security will never threaten or try to coerce you to say that you need to use your money or it's going to be suspended or anything like that. We can't even suspend a Social Security number. It's not even a thing that we can do. So just be mindful of that. If you do have one of those phone calls, or if unfortunately you disclose information, many times people think they should contact the Social Security office because it's a Social Security number. I understand, but it's actually the FTC that you should contact because the number is not being used the way Social Security meant for it to be used for your Social Security, retirement, disability, and Medicare. So you can contact the FTCC, 877-438-4338. That's the phone number you want to use. You can contact them. or irs.gov/identity theft central. And there's a 800 number I'm sharing with you. These are good sources for you. I encourage everyone at the bottom of the screen, check out your credit report. You can get that free one time per year, annualcreditreport.com, just to make sure that there's nothing on there that should not be. Now, if you also suspect any fraud, you can put yourself on the do not call registry, do not call.gov, pretty self-explanatory, or call the 800 number, the 888-382-1222 number. Now, we do have a source. Let's say if you disclose your Social Security information and someone tried to use your Social Security earnings, or they tried to do something and is related to Social Security, we do have a source that you can contact. That's oig.ssa.gov. So going back, so you can see the screen here, if it's not related to Social Security, it's just a Social Security number, you contact the FTCC. Or if you wish to contact us because they try to use Social Security benefits, that's OIG, Office of Inspector General.ssa.gov. If someone or you have a loved one or even a neighbor or someone that you look after and you talk to and you possibly suspect some type of elder abuse, please use this number, 1-800-677-1116 or eldercare.acl.gov to report that information. Last thing I'll share with you is how to apply for our benefits, because people were asking me the question, well, Social Security, it was a pandemic. Could we go to you? Social Security offices were always open to the public in terms of our 800 number and our online services. And we had to limit if we could have anyone walking into our office. Now, since April 7th of this year, individuals can walk into our office. However, things are still underneath the pandemic guidelines. What's my point? You can go to the Social Security office and depending on where you're going, we may have different guidelines to say whether or not we can have so many people in the office. So you still can call our 800 number. I suggested that you make appointments first. Call just to make sure that you have all what's needed and that we can help you out. Many times we can answer the information via the website, socialsecurity.gov, or our 800 number. And I'll say this, we're transitioning into a new phone system. So if you wish, you can call us, but here's the easiest way. You see on the screen, it says 8 a.m. to 7 p.m. Well, you can contact Social Security 8 a.m. to 7 p.m., but it is easier. You can contact us later in the day, later in the week, later in the month. Later in the day, 10 a.m. or after. Later in the week, Wednesday, Thursday, Friday. Later in the month, 16th or later. May make it a little easier for you to reach someone to answer your questions or give you an appointment for the future. So 1-800-772-1213, later in the day, later in the week, later in the month. This is the My Social Security account that I was mentioning to you. Maybe you don't need to contact the Social Security office. If you have opened a My Social Security account and you just need to change your financial institution, wherever your money is going to, you can do so via opening a My Social Security account. It'll ask you a series of questions through our 2 external partners. And now you have access to do any of those things you need to do. You can change your address, your phone number, all the information is on our website by going through the My Social Security portal. That completes what I wanted to share with you today. Be sure to check out our website, socialsecurity.gov, for any information that I mentioned or other things that you would like to learn. And as always, happy holidays and be safe out there. Thank you so much.